we think this exists and should exist in the hands of the citizen athlete.
MWAD Daily Recovery, sitting in with the KStar. Hey, this is a little extra for our normal, we normally say you just need a roller and a ball, and I have a fancy special tool. We got the Leopard claw here. We think you might have the necessary equipment. This is a spoon. I'm a big fan of the butter knife because you've got the handle and you've got the blunt end.
Handle right here.
Yep. So we just need a scraping tool. Any scraping tool will do. We like something that isn't super sharp or pointy, but just this blunted edge will work perfectly for what we're going to do. So what we're going after today, forearms. We're just going to show you about 3 different quadrants and look at different ways that you can go about, look at different levels of depth and intensity you can go after. I'm going to use a little field foam just because I like a little lubrication.
And I'm just going to scrape straight on my skin because let's just say I don't have any lubrication, which is just totally fine.
Right.
Some lotion will work as well. And the idea here, first and foremost, is that we think this exists and should exist in the hands of the citizen athlete, right? And that clinicians may use this, but sometimes this is poo-pooed, ISTM, instrument-assisted soft tissue mobilization, because people are like, hey, I don't know how to help you, so let me scrape you. We're very clear about why we do this. We're trying to desensitize and reperfuse and restore how those tissues are sliding. So that's why we're using it, right?
Exactly. So we're going to start on the back of the forearm here. This is the lateral part of the elbow, outside part of your upper arm. But we're just going to start going down. We have about a 45-degree angle. We're using the beveled edge or the softer edge here. We're just going to go in long stripes along that muscle.
The idea here is work an area for 30 seconds or so, and understand that if I'm working a bigger area, it takes me a while, but we want a dose and a response. So I'm just going to hit the outside of my arm here, and if I have golfer's elbow or tennis elbow, this is an easy way where I can begin to have some different input into that system and bring some blood flow to that area and restore how those tissues are sliding. Now, I can also add motion to that, and this is one of the reasons doing it myself is really powerful, because I can scrape and move the hand so that these tissues are biasing and sliding the way they should be normally.
Now, when you hear Kelly say the words blood flow, let's be really simplistic about this. You can see now that there is increased color in the skin. There's some redness there. That just means that the capillary beds are dilating underneath there. That means we are increasing blood flow. And that's about the dose that we're looking for in that tissue. You don't need to get a lot hotter than that. So we're going to switch over to the other side of the arm. We're just going to keep things really simple. Now we're going to start here on the inside of the elbow, and we're just going to scrape down towards the palm. And again,
we have kind of a 45-degree angle. Sean's working a little bit of a lesser and easier technique. He's scraping this way, so it's this angle. I'm scraping this way, which gives me a little bit more aggressive edge. Now notice that in there, I don't have any bursting of the blood vessels. So if I get any of those little marks called petechiae, those are indicators that I've disrupted the capillary bed itself, and I've overtreated the tissue. So move on. The idea here is to get a dose and a response. Both of us are working at responsible levels just to get some motion through these tissues and some input. And again, if I have a painful area, I can desensitize this area by working it a little bit.
Exactly. And we can start superficially. So how much pressure I'm applying to the tissues can be very light initially. I'm just sort of going some pass-throughs just to experiment and get a little exploration. Once I feel like I want to start getting a deeper treatment, that's entirely up to you in terms of level of intensity or dose. Just kind of get an even pressure and just let that thing slide along. If you find any area that feels crunchy or you're hiding some Rice Krispies in those tendons, that's where we probably want to focus a little more work, where you want to start to get a little more sliding. And we like this as well, a nice broad contact surface as well. You're not going to disrupt nerves or anything else in that area.
Notice that we went down, and then I can also go up against the other direction. So work in one direction for 30, work in the other direction, and then this area is worked. That's it.
Yep.
Get a dose response. What I'll tell you is that my forearms, from the paddling, the gripping, the therapy, whatever, take an immense amount of ISTM, and it feels great. And I actually notice a difference. We want to show you our last area. You can definitely work on this rotator of the forearm. But also, right in this area, we see a lot of people have pain and dysfunction in this tendon, and this is called the Finkelstein test, right? When people have de Quervain's tenosynovitis, which is an inflammatory problem and sort of disruption between the sheath of the tendon and the tendon itself. And one of the ways that we can help with people in this area, again, using this same technique, we want to give you a way where you can improve local blood flow and restore how these tissues are moving by starting some of this scraping, which is going to initiate blood flow, desensitization, all the other things that we talk about.
Exactly.
How do we get the garbage out and bring the groceries in? Well, this is a simple idea. So your mission today, hit some of these areas up, get a dose, get a response, be curious, right? You know, you can use the tip of the spoon here and do a little detailed work as well. It's pretty amazing. But this was originally done, I think, with bones and horns. This was really done with Chinese soup spoons. Don't be precious. We love the leopard claw, but use what you have. See you tomorrow.